Okay, good morning. Today is Saturday and it is the Saturday morning class. Let me be sure we are all everything is okay from a technical standpoint. Okay. Let me be sure we are all. Yes, I can hear it nice and good. And thank you everybody who is watching and telling me that no technical glitches. Okay, today's session, and as all of you know, it's a Saturday morning yoga therapy session. We have been doing it for years and years and years. It used to be all in person, and during pandemic it became virtual, and we're still continuing the virtual program. And we bring a topic which is based on our experiences and also their feedback. So today's topic is one of our feedback, and the feedback is also from a physician friend of mine. I don't know if I shared with you last time that last week of June, sorry, what did I do now? Okay. Also, telephone call is coming in. Okay. So in June, I went to a physician conference, and there is a lot of interest about the physicians about yoga as a therapy and therapeutic yoga. And as all of you know, as I mention it all the time, that yoga is a philosophy. 196 small aphorisms called sutras, of which 193 are to quiet down your mind. Yoga is a practice. It's called an 8-limb practice. Patanjali Ashtanga Yoga, social restraint, personal restraint, your asana, like external, internal alignment, pranayama, voluntary regulated breathing, pratyahara, control of your senses, dharan, focus, dhyan, meditation, and samadhi is a union of your body, mind, and spirit. So it is all at the level of meditation, which is the 7th limb of yoga. Remember, yoga and meditation is not two different things. People always come and ask me, oh, I want to practice meditation. I don't care about yoga. I said, no, you can talk about asana, which is the preparing your body, and pranayama, preparing your breath for the 5th limb, which is called your pratyahara. Pratya means reject, ahara means input. Learn how to control your senses, then enter into a focus called dharan, then you enter into meditation. And for all the physicians, because they're all Western trained, they have a reductionist mind. They're all looking for meditation is the medication. And he told me, I want to learn meditation. I don't care about these physical postures. I said, great. But how do you do the meditation? Oh, I want to sit down, I close my eyes, I want to do some breathing practices. I said, do you know the outcome of meditation? Oh yes, we're learning for a physician. I said, yes. In meditation, what happens? We have thought process. We are generating thought process. We're generating thought process in thousands. Majority of our thought process in our past. And with a large number of thought process in our future. Very few thought processes in the present. But all the thought processes in the present, 95% of the thought process are called repeat thought process. Chattering of your mind. Chitta vritti nirodh. So, chattering of your mind is like here. It's Saturday, I have to be here, I have to give a presentation, and it is continuously chattering my mind. In a state of meditation, you enter in between the two thought process, which is called a gap, and slowly you extend your gap. Essentially, you really do not have no thought process. You still have the thought process, but the thought process now gets into a file and a folder. So it doesn't chatter your mind. So when it does not chatter your mind, what happens? It acts on your limbic system, the emotional brain, amygdala and hippocampus. Limbic system now controls your hypothalamic, pituitary, autonomic nervous system axis, and you can see if you are wearing the health tracker during the state of meditation, your heart rate will come down, blood pressure will come down, respiratory rate will come down. If you are doing the hand mudras, you'll feel that the sensations are going down. You'll be able to feel the capillary pulses. But to achieve that, to have that state, you have to have a manasthit, means mind has to quiet down. And to prepare that, we have to prepare our body first, because when I am in the state of meditation, when my body is not properly ready, some twitching in the body, some sensation in my body, there's something I see, crawling sensation, all the neurological symptoms I have in my body is going to interrupt my meditation. So how do you prepare your body? You prepare your body, what yoga philosophy has suggested as is called Sthiram Sukham Asana. Sthiram is a stillness. What is stillness? When you are in any posture, doesn't matter. I'm sitting down with my spine straight. I'm sitting down because part of my muscles which gives me this posture are in a state of contraction. But if I stay in this posture for extended period of time, with listening to my body's signal that there should not have any pain, and I'm going to have an effortless breath. The yogic anatomy is called 5 koshas, Annamaya kosha to Pranamaya kosha. Any imbalance you create in the physical body, it shows up in your breath. As your breath is effortless, effortless breath means you are able to talk, you are able to sing, and you can progress. You develop a phenomena which we call habit forming. In medical terms, it's called neuroplasticity. Muscle cannot stay contracted for too long. Muscle has to relax. Before it relaxes, it causes a little bit of a contraction called fasciculation. So you feel that called fasciculation, the vibration, and slowly when it relaxes, it becomes totally relaxed, which is called sthiti, stillness. So the primary effect in your physical body, we'll talk about our breath, how to prepare your breath for meditation next week. primary preparation of your body is activation of the relaxation response. If you activate a relaxation response, then it activates your parasympathetic tone. Parasympathetic tone is called calm and digest, and it shows up in your health parameters. So, let's start in a chair. Say I'm sitting on a kneeling stool. That's why I say I'm moving back and forth. But my kneeling stool, reason for sitting in the kneeling stool is that I keep my back straight and I'm in front of my desktop computer. And you have all seen my kneeling stool probably. If not, I'll show you one more time. This is the kneeling stool. You sit down with your kneeling and your spine will stay straight, and that's the time your keyboard is here, your monitor is here, and you're working here in computer. People ask me all the time, I've been in front of the computer all the time, what I do. You are hunchback, you're looking at that, and you're creating a lifestyle related disorders called metabolic syndrome. No problem sitting in front of the computer and work. That is our work situation these days. How to do it? You keep your spine straight. So there is some very important factors which you have to remember. Okay, I have a little bit of a small pillow here. Do you need this? Yes, if you need this initially, you can put it here. You sit down, but when you sit down, keep your spine straight. Why? As I explain to you all the time, this is the practice, the beginning of your meditation practice. Our whole body kept straight high up because the muscles on the side of my spine, called paraspinal muscles, or anatomically called quadratus lumborum, they're all being contracted. You feel like two pieces of stone sitting here. But if you keep yourself straight, you are giving a relaxation to those muscles, and it feels like two pieces of pillows sitting here. So if you have to sit down, you can go all the way to the back. Be sure to keep your spine straight. Keep your feet supported on the ground. If your feet doesn't touch, put a folded blanket. Reason for putting a folded blanket is that by the time you develop the relaxation response, slowly and slowly, your feet will come down, will touch the ground. If you have a folded blanket, you can start unraveling it, and slowly your feet will come and touch the ground. When you're comfortable, after a while you will feel that this things is whole softer, feeling comfortable. You can take this small pillow out and you can clearly sit down in your chair. For us, we always like a chair with I like a wooden chair. I like a wooden chair, very solid wooden chair. This is a three-legged chair, special design chair, but it's wooden and solid, so I can keep my posture. Once you are in a posture, then also our yoga has suggested. Remember, yoga is from our original authentic scripture. There are all the books in the market about yoga. I also have a book about yoga therapy. But always practice from authentic yogic scripture. Authentic yogic scripture says when you are able to have a proper asana. Asana basically is called able to sit down. You have some meditative asanas. Meditative asanas are like your easy pose called Sukhasana, perfect pose called Siddhasana, half lotus called Ardha Padmasana, lotus pose, so full Padmasana, Vajrasana or a thunderbolt pose, Supta Baddha Konasana, not Supta, that's a Baddha Konasana, the closed angle pose. Also, you can do all meditation even laying down like your Savasana, cross pose. But remember, whenever you practice the asana, you listen to your body's signal. Practice of yoga is non-competitive. Practice of yoga listening to your body's signal. So what is my body's signal? First signal is called pain. Pain is the pay attention. Whenever I'm sitting down in this posture, I have to be in this posture until I get pain. Once I get pain, I back off. If I can stay in that posture the longer period of time, it will slowly and slowly, the time will increase, that it will allow you, your brain will allow you to sit down for an extended period of time. Pain in yoga means pay attention. Body is telling you something. Listen to your body. Next is any imbalance you create in your physical body shows up in your breath. Your breath will be interrupted. Simply, if you are sitting down in a chair, try it and you will see. We do it all the time. Suppose I want to do a little spinal twist. Okay? I put my one hand to the back, other hand in the front. I breathe out first, take a deep breath in, slowly turn my body. And I come to a posture where there is no pain, but my breath catches. I'm still okay. For me, if I come up to this far, I can feel. Even I can talk, I can sing, still I can feel I'm having a little bit of effort in breathing. So there will be no effort in breathing. No pain, no effort in breathing, able to stay in the posture for an extended period of time, preparing the body and mind in a gradual process, which we call the neuroplasticity, and we call in stages impossible become possible. The fasciculation you will clearly see when you do, say, a laying down asanas like, say, your boat pose, Nokasana. When you put your feet high up, head high up, you will see your whole body is shaking like this. But if you keep on doing it for some time, you will see that you don't have any problem with the fasciculation. We yogis, every morning we do a jalneti, the washing our nose, and always remember, when you jalneti, you should do it in the morning. Because after jalneti, we do a few Kapalbhati pranayama, because we have some water already in our sinuses. And throughout the whole day, even when you put your head down, sometimes you can feel some water might come out. So our suggestion is, don't do a nasal washing or jalneti in the evening or at night and go to bed, because all the water which is retained in the sinuses are a source of infection. Anything which doesn't drain gets infection. Sinuses blockage, you get infection. Even when the tract has a blockage, you get infection. So just think about preparing your body in steps, listening to your body's signal, no pain, effortless breathing, and using your hand mudras and using the power of your five senses to enter into a state of meditation. Like yesterday, somebody asked one of our yoga teacher that in yoga practice, how did the mudras, hand gesture, bandhas, the spiritual locks, chin lock, abdominal lock and root lock, kriyas, the clenching of your physical body, tratak, nasya, dhoti, basti, kapalbhati, naudi. During the practice of yoga, which goal was the self-realization, it was infused with mudras, bandhas, kriyas, and also Ayurvedic philosophy. Ayurveda comes from the same root as yoga, and it became yoga chikitsa, called yoga as a therapy. So for us, meditation is medication. And if you look at the two words, only difference is meditation has one T, medication has C. Rest of the letters are all same. So it's a T is for transformation and C is for choice. Transformative choice. So the practice will be, as I said, keep your spine straight. We all talk with our hands, so touch your index finger and thumb. This is called your meditation mudra, dhyana mudra, or called it Gana mudra. It also quiets down your pitta. It's a pitta pacifying mudra. There's another mudra which relaxes your body and mind, which is called Adhi mudra. Put your thumb inside and close. This is also called Balo Mushti mudra, like baby fist. When you can do this fist with your breathing, your hand gets all relaxed, your fingers gets all separated. You can put your fingers fit like this. So you can either use a meditation mudra or you can use a Adhi mudra. This is another meditation mudra. You put your one hand in the top. Generally, you put your left hand on the top of your right hand, and then you touch your tip of your thumb, put it just over your lap, and close your eyes. The moment you close your eyes, you start controlling your five senses. Pratyahara, fifth limb. Mind in yoga is described as a content of your five senses. I hear, I see, I smell, I taste and touch. If you put all the contents in a container, that's your mind. When the contents get more processed, it becomes your intellect, called buddhi. When your buddhi gets more processed, it becomes your wisdom, ananda. Manomaya kosha, Vijnanamaya kosha and Anandamaya kosha. You will notice one thing the moment you close your eyes. Your thought process, especially the repeat thought process, slowly and slowly disappears. Initially, your mind is like a fall, like a Niagara Falls. Slowly, mind will be like a river. The mind will be like a pond, clear water. You will be able to see all the way down to the floor of the pond. When you have mind is still chattering, your relaxation response is not sitting in, use the power of your breath. Remember, the whole healing power is just underneath our nostril, our breath. So prepare your body. How to prepare your body? Able to sit down, either in a chair or in the ground, in stages, preparing for sit down in extended period of time, not being interrupted by any body signal. Relaxation response, Shithilikaran asana. Lung is like a balloon. It has 6 liter capacity. It needs 1.5 liter to keep itself open. It has 4.5 liter of air which you can exchange. Blood brings all the impurities, get exchanged through alveoli in the lung, which comes out as your out breath. And in inhalation, you bring all the oxygen inside your lung to be exchanged in the alveoli level through capillaries into your blood. Arteries carries the pure blood and the vein carries the impure blood. So breathe out first. Then visualize your breath. This is your visual imagery. You can do a lot of visual imagery. You can look at, closing your eyes, you can look at a flame, a burning flame in front of you, or you can keep your eyes open, look at a flame, which is called tratak, Jyoti Tratak. Jyoti is a light, Sarkar is controlling your eyes. Remember, eye is the extension of our brain. Behind the retina is the optic nerve which goes straight into your brain. Our whole brain is covered with the skull, but the eye is directly connected outside. So visualizing the air coming in through your nostril. But remember, you're using this visual imagery to prepare your body. Next session, I'll show you how to prepare your breath for meditation. Visualize the breath is coming in through your nostril. All the air gets filtered inside the nostril. Nose is also our personal air conditioner. If my outside air is warm, it will cool it down to the level of your body temperature. And if outside air is cold, it will warm it up to the level of the body temperature. Visualize the air is going on the side of your nostril called turbinate. When you're visualizing, you will notice the thought process is slowly and slowly is going away. Nothing is bothering you. Nothing is telling you that you have to go and do a grocery or you go up to pick up this and all the thought process. And if you feel what I'm looking at feeling now, this two thumb is touching, I can feel the sensation is going down. And I can feel the capillary pulsations, I can feel. That is a stage of meditation. When the air goes to the side of the nostril called turbinate, it picks up a velocity called a vortex. That vortex when goes over to the mucous membrane of your sinuses. It releases a substance called nitric oxide. Nitric oxide is a potent vasodilator. That means it opens up the blood vessel and is a protector of endothelial health. Endothelium is the lining inside your blood vessels. And nitric oxide is keeping the endothelium healthy. Endothelial health is the real health. Salutogenosis. Salute means your health, genesis means your origin. Origin of health comes from healthy endothelium. Nitric oxide is also mediator of parasympathetic tone. Cyclic GMP, acetylcholine, nitric oxide. Keep your focus on your breath. Visualize your breath coming behind your throat. When you breathe through your nostril, all the air goes into the larynx and the trachea. That means whatever you are breathing through your nostril, all the air is going to your lung. If you breathe through your mouth, breathe in, you have no idea where the air has gone. It might go to the stomach, go to the lung. Visualize the air inside the trachea, which is a tube which divides into multiple branches called bronchus, right and left bronchus, and the bronchioles goes to alveoli. Visualize breath is in the upper part of the lung. That it comes in the middle part of the lung. Lower part of the lung. Breath comes down almost to the level of your belly button. Because when the lung is expanded, the lower lobe, it pushes the diaphragm down, the muscular organ, almost to the level of your belly button. Breath automatically stops here. It's called a cable kumbhak. Give a little pause after inhalation, then visualize your breath. Visualize it is in the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, back of your nose, came out through your nostril. Every asana pose, to prepare your body, you will feel like you are in a state of Savasana, corpse pose. Every asana practice, when you are able to prepare your body for meditation, every asana practice will feel like that it is your normal body posture, that you are able to sleep. You are doing a triangle pose, Trikonasana, you'll be able to stay in the triangle pose, closing your eyes with proper breathing, breathing out longer than breathing in, as if you'll be able to sleep, you'll be able to in Savasana in a corpse pose. That is the preparing your body for the meditation. It's not forcing yourself. Exercise is workout. Yoga practice is work in. So, if you are in a meditative state, we have a lot of breathing technique because breath is the connector between your body and mind. Metaphorically, what I say all the time, that you're flying a kite, the roller in your hand is your body, the kite is your mind, and the breath is the thread connecting the roller to your kite. It's a nice way of saying. So when you prepare your breath after your body, you enter into a state of meditation. But even in the gradual process, remember, meditate, you don't jump from asana pranayama to meditation. That's what people say. Oh, yeah, I want to do asana pranayama and meditation. There are 2 steps in between. Asana is a 3rd step or 3rd limb. Pranayama, the voluntary regulated breath, is the 4th limb. And meditation is the 7th limb. 5th is a pratyahara, control of your senses. 6th is a dharan, is the focus. When you keep your focus as if you are following your breath, or you are looking at a flame of a candle, or you are sitting in front of a ocean, sitting in ocean, or looking at the tip of a mountain. You will be able to control your 5 senses. Nothing is going to bother you. In fact, in a state of meditation, when the research is being done by doing a functional MRI on the brain does not respond to external stimulus. In a state of meditation, if you give a sound, the brain does not react to it. That is called a state of pratyahara, 5th limb. Then when you keep your focus, dharan, slowly and slowly it gets defocused. Then you enter into a state of meditation. In the state of meditation also, your breath becomes the carrier of your life force called prana. Prana is a subtle energy which keeps us awake, alert and alive, and also it does a healing for our organ, which is called pranic healing. Hand gesture mudras. These mudras are called neurophysical connector. That means it connects your body and mind, neurophysical connector, to guide the prana to the organ of healing. That's why we have all different mudras which are therapeutic mudras. Vayu mudra controls your pain and water-related disorders. Shunda mudra improves your hearing. Prithvi mudra, grounding, quiets down your, controls your kapha, good for your diabetes, trunk and obesity. Varun mudra maintains your body fluidity, controls your bladder. Shakti mudra gives you strength. Apna mudra, Pachan mudra, digestion mudra, cleansing mudra. Apna vayu mudra, Linga mudra. Linga mudra, it warms up, it removes the flame. Very powerful mudra for your children. Ganesh mudra, remover of obstacles. Hakini mudra, Shankha mudra, Dhenu mudra, or Shirobhi mudra. So, the asanas which you can sit down in your chair. Also, you can start doing relaxation of your spine. The spine, when you do the spine, it gets relaxed very easy. A relaxation response of the spine starts by keeping your spine straight. So the technique we use, this will develop slowly. You are able to sit down in a squatting pose called Malasana. When you are able to sit down in the Malasana for an extended period of time, you will notice you are entering into a state of meditation. Look at Malasana. Look at this squatting Malasana. Relaxes your ankle, relaxes your knees, relaxes your hip, back, you name it. But the whole yoga practice is holistic. That means if I can relax a part of my body, my whole body gets relaxed. So I can put my hands, separate my fingers. This, when you're able to separate your fingers, your hand gets relaxed. You do extension of your wrist gets relaxed. Put your one elbow inside, other elbow inside. Slowly bring your hand close to you. Keep your spine straight. Look straight. With your eyes closed, and if you can put your focus just underneath your nostril on your breath and visualize the breath coming in and going out, you have prepared your body for the state of meditation. And what I tell everybody, if you're able to do it for extended period of time, all the lifestyle related disorders will run away from you. Lifestyle related diseases will say, hey, this is not the body I need to be in. There will be no fasciculation. There will be sthiti. There will be sukham. Happy. I'm very comfortable sitting in this posture. And I love to sit in this posture because it literally quiets down our mind and enters into a meditative state. Personally, I can tell you, we don't know how many times we do it daily. Continuously we're doing it. Able to get up without a support. And able to get to your body into a spine straight. Go to the back of your wall, touch your hips, back, head, all the way to the back, able to stay straight, connected to the body. The moment you're able to keep your spine straight, you enter into a state of meditation. Let me get this here. Sorry. Now it comes preparing your body, what is called your meditative asana. That means preparing your body with the asanas for meditation. The first one, easy pose, Sukhasana. Take your one foot under your knee, take the other foot under your knee, and slowly you drop your both the knees down. There will be no pain, no fasciculation, sthiti, and you'll feel a profound level of comfort. Just adjust it. Just 1 second. If you, first time when you get a pain, you back off. Find the posture where there is no pain. Find the posture where there is no fasciculation, and then use your power of your breath and the eyes closing, controlling your mind. This thing is going to happen. When you're able to sit down in this posture with your spine straight, your mind quiets down very easily. This is preparing your body with a hand gesture called Mudra for meditation. Level of comfort is very, very important. Same posture, change your feet. Change your feet, go to the opposite side and sit down. What it does, it balances both sides of your brain. Our right brain is intuitive, left brain is analytical. So when you get a balance between right and left brain, you enter into a state of meditation. The lateralization of the brain is the root cause of all of our diseases. Sukhasana is a meditative asana. Siddhasana, perfect pose. Take your heel to the back, put your one foot on the top, and your knees will drop down on its own. If it doesn't drop down, if it stays high up, let it be here. Reason is, if you push it down, what will happen? It'll come back high up. And when you do that, you'll feel a pain in your left hip, pain in your right hip, or the knee, hips, back, everywhere. Do not go up to the level of pain. And I hear so many people, I just have a very long-standing yoga practitioner. I'm sitting in a lotus pose for a long time and I'm getting into a pain and numbness. So I said, you back off a little bit and then put your body against the wall. When you put your body against the wall, what happens? If you support your body against the wall, your spine gets straight. When your spine remains straight, the tightness of the muscle goes away. You enter into a relaxation response. Once you enter into the relaxation response, then you can progress one step at a time until you come in a asana leading to your meditation. So, a lot of people ask me, do I have to do anything special for meditation? Nothing special. Prepare your body as if you're in a relaxation response. There is no symptoms in the body is going to interfere with your thought process, and your breath has to be totally effortless, and you'll be entering into. Same way, Siddhasana, opposite side. Ardha Padmasana or Swastikasana. Same process, same phenomena in stages. Feet gets relaxed when you put your finger inside your toes. When you separate your toes, feet get relaxed. So we recommend that you put your one hand here, one hand through your, separate all the toes. You'll be able to sit down very comfortably. When you will feel your body is ready for meditation, your breath will be ready. Your breath rate will come down. Your length of inhalation and exhalation will increase, with exhalation longer than inhalation. And your breath will be in a state as if you don't even hear, you don't even know what is happening into the breath. Go to the opposite side. A little bit of a technical issue. Let me see if I'm okay. Okay. Yes, okay. I hope you guys are hearing okay. So, next one, I will have a Ardha Padmasana for your meditation. And after Ardha Padmasana, as you say, we're doing also on the left side, one on the right side, and then from Ardha Padmasana, you can go back to your full lotus, Purna Padmasana. It is a meditative asana. Preparing your body able to sit down in this posture for extended period of time is entering into a state of meditation. You will develop some numbness of this foot when you're in the lotus pose. When you get a numbness, you always back off. I'm a vascular surgeon. My concern is the blood supply. What happens when you do blood supply? So we have a blood vessel here called dorsalis pedis artery. There's an artery. I can feel a pulsation here in the top of your foot. Okay, so the way what I do here first, if you move your great toe, you will see there is a tendon here. Next to the tendon, if you put your finger here, you will feel a pulsation. This is called pulsation of the dorsalis pedis artery. This is one artery in the foot, and in between your malleoli, medial malleolus, and your tendon behind, called tendo achilis. You put your finger here, you feel a pulse. It's called a posterior tibial artery. I feel clearly those two pulses now. Next I'm going to do, I'm going to put my feet high up. Remember, with this, there is a blockage or a kinking in that artery when you don't have the relaxation response. I will be feeling that pulse excellent pulse. I'm feeling on both sides. So I'm getting in a little bit more. I still feel the pulse fine. Initially, when I was doing it, in this posture, the pulse was disappearing. Short time I was feeling a sensation of called ischemic pain and a numbness. Very interesting is, I was doing this posture, and if the physicians are watching it, they'll understand the pulse comes back. We're dropping it down like this, the pulse was disappearing, and I was having symptoms. The moment I was having symptoms, I did this, and the pulse came back. We have an instrument called Doppler. You can do one day, put a Doppler and show it to you. You will understand what I'm saying. So, feeling the pulses, I have no fasciculation on my body, no pain sitting down in asana. There's no neurological symptoms, no numbness, no fasciculation, no. Sometimes we feel there is a bugs are crawling in your feet. Any asana which keeps your spine straight is preparing your body for meditation. That is also true for your Dandasana. Dandasana, see here, keep my foot in front. My spine is straight. My hands are on both sides, looking straight at you. Touching the ankle and the knee at the same time. Relaxing. It's very a relaxation response and relaxing phenomena. Separating your toes with your breath, like breathe in, breathe out. These are called Asana. Shukha means very mild asanas. Asana basically means this is your meditative asana. Asana to practice for meditation. Another powerful asana you can do against a wall. You can always bring your body against the wall and keep your spine straight. Even if you're doing a simple Sukhasana. If you do a Sukhasana, keep all the way to the back, keep your spine straight. You enter into meditation very quickly. Remember, meditation means there is no extra thought process. There is no repeat thought process. There is no chattering of your mind. You can also start doing what is your Baddha Konasana. Same way, you will see your knees are not coming down, and when you keep your eyes closed, keep your spine straight, and do a little bit, this is called a Titli Asana, they will come down on both of your sides. So asanas with your spine straight, meditative asana, preparing your body for your meditation practice. Able to sit down in a Vajrasana, and I hear it all the time. I've been trying in stages. People who have a knee problem, we see so many people with a knee problem these days, they get a knee replacement for pain. If you get a knee replacement for pain, you never get any better results. When you have a deformity, non-functional knee, you get a knee joint replacement, it's a very good result. For the knee, we tell them to sit down very gently in a Vajrasana. So Vajrasana practice initially you can start sitting on your heel. Keep your eyes closed. Use your hand mudras, either your Dhana mudra, Adhi mudra, or even your meditation mudra. You'll enter into a meditation. Slowly, you separate both the feet, see if you can able to sit down in between your feet. And this is the time, I hear it, all the discussion. This is your meditative asana, Vajrasana. Okay? So, you have an issue. First, what you can do, you cannot sit down all the way down. You can put one under your small pillow or a roll under your ankle. So that I'm putting under my ankle and I'm entering into in a thunderbolt pose or a Vajrasana. These are all come to practice, neuroplasticity, practice. So, same way, when you are able to sit down, you have an issue with your hips, you can take this pillow and put it under your hip and you can sit down very comfortably. Sthiram Sukham Asana. So for the Western audience, these are called your reductionist holism. That means you are whole, and reductionist means you're using the part of your body and mind. But for yoga practitioner, it's a practice of your body, mind and spirit simultaneously. Any asana which will prepare your body for meditation, again and again remember all three components, Sthiram Sukham Asana. Stillness, happiness in a pose that will lead you to the fourth, fifth, sixth, to the seventh limb of yoga. Thank you for joining and participating. And this was a request from a physician friend. He just wants to learn only meditation, but he doesn't want to do any of the physical asanas. So what I told him, meditation is the inner part of your house, and you need to enter the house through your main entrance. Your main entrance is your asana. You start and practice yoga for physical reason, but you stay in yoga and stay in yoga practice for spiritual reason. Yoga practice is a spiritual practice. Spirituality means believing in a power above me and surrendering. When I believe in a power and surrender, my body, mind enters into meditation to create spiritual wellness, mental wellness, and physical wellness. Thank you for joining again. So next Saturday we'll come up with another session. That session will be on your preparing your breath for meditation. I've seen a lot of meditation practice where they close down their eyes and sit down in silence. It is fine. It's a wonderful meditative practice, especially when you do in a group session. And when you monitor, like you're monitoring me, you're monitoring my cardiovascular system, my heart rate, my blood pressure, my heart rate variability, whatever you want to monitor, you will see the person behind me, person on my side. Heart math, they will have the same effect. Okay, so see you again on next Saturday. Preparing your breath for meditation.